when you have the disease, you certainly have blood clots, okay? Micro, they call them micro or small blood clots where you even can't see. That is why we, as standard treatment, use one blood thinner for anybody who is hospitalized. Now, with vaccines, you may develop blood clots, but for the disease, you certainly will develop blood clots. So if you balance the two of them, definitely the disease comes at a worse price, no? Than the vaccines. And I don't want to make it sound like damn if you don't and damn if you do, but you definitely will have blood clots if you have the disease. And we see that as part of the way how this virus damages your lungs. Not only the tissue itself, but the blood vessels that supply blood to the lung. I would dare say that we are, at least for the first 5 years, we are need to get our twice a year or 3-4 months checkup just to make sure that everything is good, no? And identify things before it gets serious. So you get your checkups regularly, but again, Marian, it affects all organs. So you have to also be checking your liver, your kidneys to make sure that they remain in good health, no?
And in the meantime, then, for people who simply will not be able to afford all of these examinations because of the mere fact that they're very costly, and a lot of people who are affected by COVID are poor people or people who are less fortunate, no? What should they be doing at home to at least try to
make sure that they have their underlying condition under as best control as possible. They take the medication, they try to eat healthy, they avoid processed food, they avoid salt, they avoid fatty food, that kind of thing. And at least every 3-4 months, check with your physician, let him do an examination, listen to your heart. A chest x-ray might be helpful, a simple chest x-ray that costs like $45, which would start give you indication whether or not your heart is having any trouble. And the same thing that you refer to, the EKG, no? And those things are available in the public setting. So the access to that is very much there, no? So the frequent examination, the discussion, a chest x-ray and EKG would be very helpful to see what's going on with the heart. And a low dose, unless there's a reason why you can't take aspirin because you're allergic to it or because you have ulcers in your stomach, an aspirin a day will keep the cliche, no? Will keep the doctor away and help with the blood clotting issues. No? The take-home message here, Marian, is for all of us to be very careful and try not to get the disease by using the public health measures of the washing hand, the face mask wearing, and the physical distance, and use one of the tools that is now available, the vaccinations. No? So all of that put together. And then I have to say this, you hear this thing about my body, my decision, but it's not just about your body, it's about people who surround you. So I can't see it anywhere else than being selfish, actually.